In the light of the rising cases globally, India is on high alert. The Health Secretary has now issued guidelines to states which needs to be implemented for the upcoming festive season. It goes on to say that there is a need to put in place requisite public health measures and other arrangements to minimize the risk. It says strengthening focus on test, track and treat and also vaccination. Adherence to COVID appropriate behaviour, that means it's the basics. You need to wear a mask. You need to sanitize your hands, you need to maintain social distancing and others as well. Let me bring in my colleague Sharon Elizabeth, who in fact has been tracking these developments for us. Sharon, talk to us about the fine print of what people need to follow as far as the upcoming festive season is concerned.
Well, remember, this is not a mandatory guideline that has been issued by the government of India. This is an advisory to all the state to ensure that there is, in fact, all these protocols are, in fact, followed on ground. Now, starting with the basics, like you mentioned, maintaining social distancing, putting on a mask when people are going in an overcrowded place. Apart from that, an advice, in fact, has been given to state that there should, in fact, be proper test, tracking and vaccination and testing that needs to be done. And before as well, the states have in fact been informed that when a person is tested positive in their particular state, the sample needs to go for genome sequencing. Apart from that, the vaccination, in case there are people who have not taken the second dose or in case they have not taken the precautionary dose, that also something that needs to ramp up in each of the states. And also they have advised all the states to ensure that in the upcoming festival season, also keeping New Year in mind, the stakeholders or organizers of certain parties or events should in fact avoid overcrowding. True. And in case they are doing this in an indoor area, then there should in fact be proper ventilation. Apart from that, all protocols like social distancing and mask is something that should in fact be maintained when such events and parties are happening in the upcoming festival season.
Sharon, the other important aspect that I want to understand, and if there is anything mentioned on those lines as far as these advisories are concerned, is what about our medical infrastructure? Because that was a big concern, specifically when we remember the kind of pictures and videos we saw around the Delta variant. So what are the kind of precautions that are already being taken to ensure that if this is a worst case scenario, cases do go up, are we already prepared?
Now, this has in fact been mentioned in both the guidelines to the states, also in the meeting that was held today at about 3:30 p.m., which was chaired by the Union Health Minister. The states have in fact been told that they have to ensure that the infrastructure is well ready enough to be prepared for any situation. Right now, India is facing a better situation, but in case the situation goes out of hand, they need to be well prepared. That includes the oxygen PSA plants in each of the health centers or hospitals. Apart from that, the ICUs, ventilators, hospital beds, the infrastructure need to ramp up and increase. And in case there is any sort of shortage of such facility, then the health ministry should be informed and accordingly they will be helped, is what the health ministry has said. And also remember, the health ministry has also told the states that they need to do a mock drill that is going to be on 27th of December. And in this meeting, all the state health ministers have in fact agreed that they are willing to do a mock drill on 27th December. That is the whole point of a mock drill, is to be well prepared, because they are going to pretend as if a patient positive patient has entered the hospital, and if whether he or she needs an ICU, ventilator, oxygen PSA, all that will be checked in this mock drill. And the Union Health Minister himself will in fact be present in one of the Delhi government hospitals to ensure that this mock drill begins and is done across the states in all the healthcare centers and the hospitals.
Okay. Sharon, I also want to speak to you broadly as far as this variant is concerned. BF7, of course, the worry is that this is the same strain in China. And unfortunately, cases have been detected here in India as well. But now many reports suggesting that possibly the first few cases were in India as early as the month of July. So if the cases haven't gone up, are we still in a vulnerable position?
Well, the experts, even the health ministry has been saying that we are in a better situation. There is no need to panic, but at the same time, preparedness is something that needs to be done. When we talk about the present situation in China, Japan, US, Korea, except for China, there are other states, there are other countries from where the passengers are coming to India. Indians are going to these places, and even from China, there are connecting flights that are coming to India. And being COVID-19, being an unpredictable variant, unpredictable virus, and having over 150 variants, sub-variants of Omicron, it becomes all the more important that we are well prepared. And that is why all these measures are being taken. The government of India is being proactive. You rightly